Good morning. It is so good to be back on the air with you this morning. I was off for a week, enjoying staying home and taking in the beauty of the fall weather here in the Tennessee Valley. And part of my staycation, if you will, was I got to work in my yard and exercise a little bit more than I typically do. So perfect time for me to have Jack Silberman lead off the show with us this morning. He's back on from In Shape MD. Good to see you.
Great to be here, Julie.
You clearly have not been in Tennessee for the last week because you're very tan.
I have been in Florida, actually, so I've enjoyed a little bit of vacation as well.
So you said when you came jogging up our stairs this morning, hey, Julie, I want to focus a little bit on what we do at In Shape besides just the exercise part and even the nutrition part. There's a medical component. You get to the root of the problem, if you will.
Absolutely, Julie. Before you start any exercise program, they always say you should visit with your doctor, make sure everything's clear. We do an extensive program before we start anything. We do labs, comprehensive labs to see where you're at, to make sure everything's okay. You meet with the doctor. We have a telemedicine call. We could review a little bit of your history. We do an assessment and orientation, and then we actually get you started, not just in the nutrition and the weight loss part, but into personal training as well, because we realize that this has to be put together for you to be successful.
So when you say that you're looking at that blood work to kind of see what your general health levels are, what are you looking for in that blood work?
It's a complete panel, and then the nurse practitioner...
Like glucose and that kind of thing?
Yes, everything. And the nurse practitioner will review that with you. If there's anything outside of the numbers that we need to look at, she may recommend something or refer them out. But we just want to make sure they're properly prepared to go forward.
Okay, I'm sorry I'm asking you 1,000 questions, but I think I'm going to guide you to the answer I'm expecting. I don't know. Let's say that somebody were to have this done and you see that there's a thyroid issue.
Yeah.
Then that might be an indicator for you that before you tackle a weight loss problem, their thyroid could be the culprit.
Exactly. Or something hormone balancing might be out of whack, that we can adjust that might make a big difference in the weight loss and the exercise.
Right. So this idea of making sure they're healthy first shouldn't surprise me any, because you'll have to refresh my memory, but once they've gone through the weight loss component, at some point they began to do some training with your personal trainers, and part of that also involves this kind of new aged way of seeing what their heart rate is at the moment, so that you're constantly monitoring the safety that they're going through.
Yes, and we use a system with a heart rate monitoring system that we could monitor their EPOC, exercise post-oxygen consumption. So we want to take them to a level of training where they're going to burn calories all day long, not just during that first 30 or 40 or 50 minutes that we work with them.
Are you going to find, do you think, Jack, that these next few weeks are your busiest time of the year, even more so than January, because folks want to look good going into the holiday season?
You know, it's funny. It's a mindset, but January is always the time when everybody feels like they're starting over. They've had it, whatever happened in the past year.
Turn that calendar.
This is it's a new calendar, new time. But the people that are wisest start now, because they get a jump start before the holiday gets here. So when January 1st comes, they're already close to or right at where they want to be before moving into the new year.
It also is not, doesn't take long with your program, right? Because remind people of how quickly your folks see results.
The average weight loss for a female on the weight loss in 1 month is 20 to 25 pounds. For a man, it's 30 to 45 pounds. So that's a tremendous jump start for somebody coming into the new year that wants to drop some weight.
Right. Then you also have different ways of approaching that.
Yes.
Because I know in the beginning we would always talk, and that's fine, about the HCG. But then of late you've had people coming on talking about other things that they have done. And you've got that, what is it, weight loss in a box?
Yeah, weight loss in a box, which is so cool. But yeah, there's so many different methods that we can get them there. The main thing is we want to motivate them. We want to get some of the weight off quickly, so it'll generate that internal motivation to get them excited. And then we start managing their health. And then once we get them the weight down and we start increasing their lean muscle through training, now their body becomes a furnace and starts burning fat for fuel rather than storage.
If somebody has maybe recently had their general practice physical, their yearly physical, maybe a blood work panel was part of that, can they show you those results? You don't have to do it on your own?
No, that would be great. So they could bring in those labs. We do look for certain things, so if they don't have something, we will go ahead and get those.
Okay, so here's where you'll find him. It's Jack Silberman at InShape MD. The whole practice there in East Brainerd, prepared to help you from start to finish.
And we do have an 8-week shape up, which starts now, right before the holiday. So it includes the personal training, the nutrition part, the medical part, the labs. Everything's included for 8 weeks, and they're doing a nice special right now. It's 50% off everything.
Wow, that's a great deal. And I do want to tell you, since you mentioned that I have been kind of cursing you a little bit, and you don't know it. Because the last time I saw Jack in person, I had told him I'm a creature of habit, and I do push-ups every morning. And he said to me, well, if you really want to take it to the next level, if you'll go slower, you feel more of a burn.
Sure.
So just when I was feeling cocky, because I could do 30 in a row.
Oh my goodness.
I tried your slow method, and
tough.
I was trembling. That's hard.
Yeah.
But it works.
Perfect.
So thank you.
You're welcome.
Just a little plug. We're back after this.
Attention sleep apnea patients. Millions of Philips CPAP machines and ventilators have been recalled due to health risks and